So I just want to thank you all for coming to the meeting. It's a really important case. I hope you read all the information that I gave you prior. So for some group rules, I want everyone to be punctual, and I want no texting or checking emails during this meeting. I want everyone to respect each other and their ideas that they have, and always know what your team and individual's goals are. I want everyone to have a positive attitude and to make no assumptions, and just know that everyone has an equal part in this role.
So some issues that I noticed with our patient is that she's missed multiple visits to the hospital. Also, she is diagnosed with depression and does not attend asthma clinics. So all of this falls back to the child. It interferes with the child's social life.
I do think there's a lot of strengths, though. Deanna is enrolled in school, so that's a start. And then I know she's receiving medications for her asthma. I don't really know how much she is taking, but I know she does have an inhaler. And I'm glad we're all here because, we're doing something about it. And I also want to not only take care of Deanna and her mother, but the rest of her children, too. And, but we have the pharmacist here to educate them, so.
Some other things that we should be aware of that I've noticed is she's a single mother of 4 children. They're African American family. They are not attentive to health care, and school is not prioritized.
Okay. So before you guys came to the meeting, I asked you guys to make some plans or some ideas that you had for this family. So for me as her nurse, I want to establish a consistent weekly appointment schedule to make sure she's taking everything she's supposed to be taking, and then just make sure everything's running smoothly.
Well, as the clinical pharmacist, I would love to make sure that Diana and her mother have an understanding of the medicines and prescriptions they're taking. So by doing that, I want to make sure that they're on track with their scheduled medication times and the times they need to be taking these medications. And also, they take a form of an inhaler that takes more time in using, in contrast to your typical inhaler. So I definitely want to explain to them what the importance of using that inhaler is.
I also want to schedule parent-teacher conferences so we can keep up to date and have constant communication with Diana and her mom.
I also want to make it clear to our patient that we're here to help her. We're not here to bash her on her parenting skills or anything like that. But I want her to know that we are here as a team, and if she has any questions or any concerns, then she could always come back to us for help.
Yeah, and I definitely wanted to make home visits, and she does have a history of negligence.
Yeah. Okay, that sounds good. Okay, so I just want to thank you all for being here, and hopefully we can set up an appointment soon. So hi, my name is Ashley. I'm your daughter's asthma clinic nurse. I just wanted to thank you for meeting with us and my colleagues. We just wanted to meet with you just to share ideas and to help you and your daughter in any way that we can. So my job as a nurse is to give my patients information on how to avoid triggers and on how to manage their asthma. So I've noticed that Diana has been brought to the emergency department 7 times in the past year, and it worries me that she does not consistently attend her appointments here at the clinic. So because I have concerns for her health, I want to help your daughter as much as I can. Therefore, I want to establish weekly consistent appointments at the clinic. So with me I have Manny. He's a clinical pharmacist who will help Diana with her medication.
Hi Diana, as my colleague said, my name is Manny. I'm the clinical pharmacist here at the hospital. I just wanted to go ahead and let you know that I'm in charge of making a plan of treatment for you. I'm also here to educate you guys about the medications that are being used for your asthma and also the side effects that come with it. I am also here to serve as a reference to other medical specialists that you may need in the future or at the moment based off any upcoming symptoms you might have. Also, I understand that you're using a form of asthma inhaler. It's not like your typical inhaler that you would use. It actually takes a little more while to set up and a little more while to actually administer. I just wanted to go ahead and give you a brief overview of how you should be using the inhaler. It's it's a recommended dosage of 2.5 milligrams every 4 to 6 hours every day. So you as Diana's mother, that's what I would recommend to do to make sure that her current state is getting better as she's using the inhaler. It's very important to have a very set schedule on when you're using this, and also take note of every time she uses it so that you can let us know how often she's been using it, so we can base it off the data we have to go ahead and jot that down.
Hi, I'm Riley. I'm the school social worker. My job is to identify anything that interferes with students' learning or affect their safety, behaviors, and emotions. I want what is best for your daughter and will do whatever it takes to solve this issue. Her asthma is affecting her schoolwork, her social life, and most importantly, her health. Asthma is a very common and manageable disease if it is properly taken care of, and that's what we are here to help you with. We want to help you establish a system so your daughter is regularly getting checked and making it to all her doctor's appointments and properly using her inhaler. Our primary goal is to have your daughter healthy, and we can accomplish this if you commit to making it to every appointment and parent-teacher conference. Also, if transportation is an issue, we can figure out a plan to fix that as long as we're constantly communicating with each other.
Hi, my name is Cassandra, and I'm your clinical psychologist. My role is to help you with any emotional disturbance you may have, and also any behavior problems that you have. I do see that you are suffering with depression, and I want to schedule weekly appointments with you so we can discuss these issues together. Having depression can be the reason that your child is missing all these appointments and also interfering with your child's life.
Hi, I'm Jasmine, and I work for the Department of Child Safety. I know you're familiar with our services. We had worked before with you and your son, and I wanted to make monthly visits just to make sure everything was all right at home. And I not only wanted to make sure that you and Deanna were getting taken care of, but also her siblings. And then here I have Dr. Dixon, the pediatric, is here to explain the seriousness.
My name is Alexandra, and I'm going to be your pediatric pulmonologist. Mainly my job is to assist you with any breathing problems that you have, if you already know that you have asthma, but to make sure that your problems don't progress and become anything more dramatic than that. Mom, my large population of the children that I deal with mainly have cystic fibrosis, although I'm able to care for and diagnose children that have any other breathing problems such as asthma, sleep deprivation, blood clots in their lungs, kind of find a treatment plan for them that is best. And my main role on this team is to find a holistic approach and to kind of check your lung strength as we go along to make sure that you're getting better and that all of our treatments are actually working. Like Jasmine said, that if we don't find a situation that works best for you, there can be some complications with your asthma, such as pneumonia, which is an infection of the lungs. One of your lungs could collapse, which at such a young age is very bad, or you could have respiratory failures, which is when oxygen in the blood becomes dangerously low, and then basically you have a really big problem. So we don't want to get it to that point. We want to make sure that we get it under control as a team and find the best situation for you.
So I know that this may be a lot to take in for you and your family, but I just want you to know that you have tons of support with us. And for you and your daughter, as well as your family, I'm hoping that this will improve her health and your guys' lifestyle. We just want you to know that we are willing to help you in any way possible, and that you can feel free to contact any of us if you have any questions.